I'm Joan. I'm going to be your nursing student for today. I'm going to do a full head to toe assessment. So what that is I'll be taking a look at your body and your skin. I'll also be palpating on some regions and also listening with my stethoscope. Is that okay with you?
Yes.
All right, can you give me your name and date of birth?
Jessica Calderon, 10/29/1988.
Okay, do you have any allergies?
No.
So for general appearance, patient is an age-appropriate female. She's sitting upright. Her hygiene is good. She's alert and responsive, and she's showing no signs of pain or discomfort. So for subjective questions, are you taking any medications?
No.
Have you had any moles that changed recently?
No.
Any excessive itching or dryness?
No.
Has your family had any health history relating to the heart, such as diabetes or heart failure?
No.
Do you exercise?
Yes.
How often and what kind of exercise?
Cardio about 2 times a week.
Good. Do you smoke?
No.
Good. Have you had any nausea, vomiting, or diarrhea?
No.
Have you had any abdominal surgeries?
No.
Good. Have you had any loss of ability in your range of motion or in your daily activities?
No.
And have you had any spinal or brain injuries or surgeries?
No.
Any strokes or seizures?
No.
Good. So I'm going to test your cranial nerve 7 first, which is your facial nerve. So I'm going to have you smile and then puff out your cheeks and then raise your eyebrows. Good. So cranial nerve 7 is intact. I'm going to test cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and abducens nerves. I'm just going to put a light near your eye, so if you could just look straight at me. Good. So pupils are equal and round and reactive to light. And then I'm going to have you just follow my pen. Good. Also reactive to accommodation. I'm going to perform the 6 cardinal fields of gazes. So if you just follow my pen again. Good. So cranial nerves 3, 4, and 6 are intact and no nystagmus noted. Okay, I'm going to listen to your heart sounds now with my stethoscope. I'm going to first listen to your aortic valve, which is on your second intercostal space, right of the sternal border. S1 and S2 sounds are heard. S2 is louder than S1. Going to your left sternal border, on the second intercostal space for the pulmonic valve. S2 and S1 sounds are heard. S2 is louder. I'm going to go down to your third intercostal space. So I'm at Erb's point, and S1 and S2 sounds are heard, and they are both equal. Going down to your fourth intercostal space. Listening for the tricuspid valve. S1 and S2 sounds are heard. S1 is louder than S2. Going to the fifth intercostal space on the midclavicular line, listening for the mitral valve. S1 and S2 sounds are heard, and S1 is louder than S2. I heard no extra heart sounds or murmurs, and she had a regular rate and rhythm. All right, I'm going to take a look at your arms now. So I'm just going to feel any pain, numbness, or tingling.
No.
Good. Just going to feel your temperature. Skin is warm and dry throughout. Going to look at your olecranon process. No erythema, blanching is present. No ecchymosis as well. I'm going to take a look for turgor. Turgor is elastic, and for cap refill, it is less than 2 seconds. I'm going to feel for your pulse. Radial pulse is +2. And her right radial pulse is +2 as well, and they are both equal. Take a look at your legs now. Any numbness, pain, or tingling?
No.
Okay. Temperature is warm and dry throughout. I'm gonna check for edema. No edema is present. Good. I'm gonna take a look here. Cap refill is less than 2. I see no signs of ecchymosis or erythema. Skin is intact and skin perfusion and color is even throughout. I'm gonna palpate your dorsalis pedis pulse. +2. +2 as well, and they are both equal. So I'm gonna listen to your lungs. First, I'm just gonna take a look at your chest. So no obvious pulsations, no heaves present, no accessory muscles are used. Her breathing is unlabored, and she has a regular rate and rhythm. I'm going to listen to your lungs, so I'll just have you take deep breaths with your mouth open, okay? So I'm going to be in her right upper lung lobe. And both of those were bronchovesicular sounds. I'm gonna go lower. I also heard bronchovesicular breath sounds. All right, I'm gonna listen to your lower lobes. Okay, going on the other side. All right, so I heard vesicular breath sounds on her lateral sides, no adventitious breath sounds, no crackling or rails. I'm gonna listen to your back now. Again, just take deep breaths every time I put my stethoscope on you. You okay? Okay. You ready?
Yeah.
Right, then I'm just gonna go laterally. So I heard bronchovesicular sounds more in midline and then vesicular sounds laterally. Again, no adventitious breath sounds, and it was clear to auscultation. Okay, so now I'm gonna look at your stomach. So first, as I'm inspecting, she has no scarring or excoriations. Stomach is flat and non-distended. No obvious pulsations as well. I'm just gonna listen, okay?
Okay.
So I'm gonna start off in the right lower quadrant. Going to the right upper quadrant. Left upper quadrant. And then left lower quadrant. Good. Bowel sounds were heard in all 4 quadrants and they were normal active. I'm just going to palpate lightly. If you feel any pain or tenderness, let me know.
Okay.
Any pain or tenderness?
No.
Good. And now I'm going to go deeper. Let me know if you feel any pain or tenderness.
Okay.
All right, so muscle tone is even throughout. No pain or tenderness noted, and no obvious masses were felt. I'm gonna have you sit up, and then I'm gonna perform indirect costovertebral angle tenderness. So I'm just gonna tap lightly and let me know if you feel any tenderness. now we're gonna test your range of motion, so I'll just have you follow me, okay? So we're gonna put your arms out for abduction, and then back in for adduction, good. And then in front of you for flexion, and then behind you for extension, good. And then for your elbows, you're gonna come in for flexion, and then come out for extension, and then in for internal rotation, and then out for external rotation, good. And then now I'm gonna test your strength, so I'll have you push out for me, and then pull in. Good, 5 out of 5. I'm also gonna have you squeeze my fingers. Good, 5 out of 5 strength. Now we're gonna take a look at your legs, so just follow me again. So bring it out for abduction and then adduction. You can do it with your other leg. Good, and then now forward for flexion and then extension behind you. And now we're gonna do, yep, good. And we're gonna do your knees, so bring your foot to the back for flexion and then forward for extension. Good. Range of motion. She has a full range of motion in her lower extremities. Now I'm going to have you just sit down. All right, and then I'm going to push down. You're going to pull up your legs. Good. And then bring it down. All right, and then now I'm going to push, so you push out. Good, and then bring it back in. Good. I'll have you push down for plantar flexion and then bring it back up for dorsiflexion. Good, and again. Good. Her lower extremity strength is 5 out of 5. I'm all done with my assessment. Can I do anything for you right now?
No.